Good morning. Good morning, everyone. Good to see so many friends here this morning. One friend who's not here in the audience is Anders Olausson, who is the president of the European Patient Forum, who we tried to get here, but he had a very good reason not to be here because he's in Sweden celebrating the 100-year anniversary of his institution, the Ågrenska, which I'll tell you a little bit about, and you'll understand how this is related to this breakfast meetings. I was in Sweden yesterday, a normal working day for me. I met the Queen of Sweden, I met the Health Minister of Sweden. There were a number of high-level people from Sweden gathering in Gothenburg at this Ågrenska Institute, which is what Anders Olausson does when he's not presiding over the European Patient Forum. The Ågrenska Institute is a unique institution. It's a place which used to be a hospital, which was converted to a place where people, children, particularly children with rare diseases from all over Sweden can come together with their families and with the experts. So if you imagine, if you were born with a genetic disease or there's a problem at birth and you get some deformations, so you have brain problems, something, and you have very unique challenges, both as a child and the parents. You feel alone, you feel left out, you know, the doctors don't know anything, the nurses don't know anything, you know, you're not really looked after. The ability to once a year maybe spend a week together with similar parents and similar children is a fantastic thing for you and your relatives. They've been doing this for 100 years. They live on donor money from various people with money. And yesterday was their 100-year anniversary. So I got to meet, and I tell you, I had tears in my eyes yesterday when I listened to all these parents and children that were performing. They were in wheelchair, and you know, it was just so moving. But I chatted to some of them, and at my table at lunch, there were a few parents and when I said I was from the pharmaceutical industry, I was the only one actually from the pharma industry. I went because I'm a good friend of Anders, and I was invited. So I say I'm from the pharma industry. And they say, yeah, I can't believe everything that I read in the papers. Particularly in Sweden with this Pfizer AstraZeneca thing, you know, everything's come out of the woodworks. So, but I know you, he said. I know your industry. You know, I don't believe in all of that stuff. You know, I know you because you've helped my child, and there's a medicine, and I don't believe in it. I know you. So I guess this is what this is all about: is that people don't know us. People don't know the pharma industry. They don't know all the good things we do. As John Lechleiter, he's the CEO of Eli Lilly, he said recently at the meeting, it's difficult to demonize someone that you have met. You know, so think about that. If you've met someone, if you've seen someone, you've met someone from the pharmaceutical industry who's doing research or anything else, it's difficult to badmouth that person because it's a real person, right? So this is at the core of what we're talking about today, is that the industry is we're not being good enough in explaining what we do and how we do it and why we do it. So it's very easy for people to demonize us. So this is really a push to become much more transparent about everything we do. You know, everything we do in research, everything we do together with physicians and other healthcare professionals. And this is really coming from the top of the industry. So let me talk a little bit about, you know, how this came about, and there'll be colleagues later that will speak more about why trust is so important and why we have to earn trust from society to continue operating the way we do. But this is a combination of tone at the top. You know, the CEOs of the industry decided that we needed to do something about this. We needed to get rid of this debate about hidden study results or, you know, whining and dining with doctors, and there's still a perception out there that there's something rotten in the relationship with the healthcare profession. So we needed to do something about that. But when the opportunity presented itself, because the European Commission, or Vice President Tajani, who is now going to depart the Commission and enter the European Parliament, I read in the paper this morning, he took the initiative to launch a platform on corporate social responsibility in the pharmaceutical sector. You might think he's head of DG Enterprise. So what does enterprise got to do with corporate social responsibility? Well, there is actually clearly a link. Because for European businesses, what do we compete with in the world? Well, we compete with brains, with knowledge, high-quality products, high-quality jobs. But we also compete with industries that are transparent, industries that are responsible. We have good labor relations. We pay people fairly. We have equality, gender equality in the workforce, and so on and so forth. These are things that are essential for Europe, European values. So Commissioner Tajani said that, and I never know I would praise him so much, but obviously I'm doing that today. He launched this initiative, and he presented a communication, which is the way of the Commission to express some views, a communication on corporate social responsibility, which is a very good read. And I can't remember now when it was. It was 3 years ago, probably 3 years ago when that was presented. And it's a very good document. It's a good read. And what it does is that it points to not only the things I mentioned, but it points to the role of the industry itself, of the sectors, to take charge and be responsible. Because the experience is that most of these things are better done through self-regulation, codes, voluntary systems, as opposed to legislation. So that was a call to all of industry to think about, what sectors should, do something. And of course, here I was, and we were, having our CEO saying we need to do something about transparency. We did decide to prioritize transparency of relationships. We did not prioritize at that time transparency of data. That has caught up with us, and hence we launched actually 2 big initiatives last year, which are now being implemented, which is the data sharing, which you know about, and it's the transparency about relationship with healthcare professionals. So we had this opportunity. The Commission said, we want sectors to do something. So we came together, the pharmaceutical sector, so European Generic Association, which I think is represented here today as well, us, CPME, the Standing Committee of Doctors in Europe. We have the pharmacist, John Schäfer is over there. We had all the different, and European Patient Forum. So we had all the participants saying, why don't we try and do something here? And we have developed a series of guiding principles promoting good governance in the pharmaceutical sector, and I'm holding them here. And I can't remember now, Chloe, was it in July 2012 or 13 that we launched these? 12, it's already soon 2 years ago. So these principles we worked on together. The Commission was nudging us, if I use a modern term in economics and behavioral economics. They was nudging us. They held the pen at times, but we did this ourselves. So all the stakeholders wrote this. And importantly, after having established that everyone is responsible for their own behavior, transparency is key. So there is a whole chapter here on transparency. Well, chapter, it's a page basically. But it talks about every partner, every signatory of this paper to make strides to become more transparent about their relationships. So we made clear in this process, we told all our friends in the different organizations that we intended to become absolutely transparent about our relationships with healthcare professionals. Now, of course, we did try a little bit to get all the other industry sectors to also sign up to this, but we didn't push too hard because there are different priorities in different parts of the industry. But it's my hope that EGA and also the device industry later on will sign up to the same code. But nevertheless, so this has been in progress for about 3 years, this conversation about how to do this and why are we doing it. But I have to admit that we still are only begun in communicating about this, because there are 3 million healthcare professionals out there in Europe, and I think there are probably only 2,999,500 that know about this. Because it's very difficult to cascade something like this. In a company, it's easier because you have a boss, a big boss, and that boss can tell the people what to do. It's not always so easy, but it works. Doctors, pharmacists, it's different. The heads of the associations are representing their members. They're not a boss. Michel here for ECHO, European Cancer Organization. I'm sure you talk about this wherever you go, but you can't tell people, you can't order people, to say something or to think something. So we still have a big journey. We are on a journey to bring healthcare professionals on board, and I think that's another background to this initiative, is to make sure that everybody talks about this. We need to get buy-in, we need to get ready for this. There's going to be a debate in the press and elsewhere in the various national parliaments about what's going on here. When this becomes known, people will ask questions about the relationship. So I'm very happy that we are launching today an initiative, a platform. This is the beginning of a conversation. We have made a certain decision in the industry to do this, okay? And I apologize if that is a bit top-down, but it is top-down. Not just to take note of that the CEOs have said that this is something they want to do. We have been encouraged by the European Commission, and we are relying on these guiding principles as a background to the new EFPIA code. So again, I look forward to working with all of you to make everything transparent so that we can go about doing what we are supposed to do, and that's to bring new medicines to patients. But in order to do that, people need to have faith and trust in how we do that. Thank you very much, and over to you, Gary.